Now I want to spend some time and talk about phototherapy types. Okay, phototherapy types. So for the phototherapy types, we have the overhead fluorescent lights, we have the LED lights, we have the Biliblanket. So all of them, just look at pictures and actually just illustrate, just talk about briefly what they are. So phototherapy for neonatal jaundice, it includes overhead fluorescent lights, LED lights, then fiber optic devices like what? Biliblankets. Okay, so let's look at each one of them. So the overhead light, this is what we got, this one, okay, from top. Okay, so the overhead light is a traditional phototherapy. This is the most common one you see in almost every facility. So it uses blue or white fluorescent tubes mounted above the infant. Wavelengths about 430 to 490 nanometers. Okay, advantages is widely available. You commonly see it in almost every facility that has this. They can treat multiple infants at once. If the space is big for you to keep two babies, fine. Okay, they actually generate heat. That's a disadvantage. All right, then we have the LED phototherapy light. This one can be used for adults too. So for this one, it's a modern device, use high intensity blue LEDs positioned overhead in the panels. So wavelength range is between 460 to 490. There's high irradiance, there's cooler operation, so there's less heat for this. There's longer lifespan and energy efficient, but it's actually more costly than the overhead type. Then for the Biliblanket, they fully call it as a fiber optic phototherapy. That's using Biliblanket or Bilibed. So it can be a bed or a blanket. The blanket is specialized. Okay, so the blue light comes out from the blanket. So you just put the baby inside and you wrap it. It's a flexible powder blanket containing fiber optic cables that emit blue light directly on the baby's skin. So the wavelength is about 450 to 470. So allows skin to skin contact. It's portable and comfortable for home use. There's minimal heat production. So it actually covers a smaller surface area. Okay, and it's not really effective like the other ones. Okay, so that's what we got for the types of phototherapy.